Hello everyone, welcome to the presentation by Group 4. Our group consists of 5 members in total, and they are Olivia Margan, Regina Sharma, Raymond Xie, Tony Vu, and Sunita Kumari Yadav. And the topic we've chosen to do is the type 1 diabetes mellitus, pathophysiology and pharmacology. Type 1 diabetes mellitus is defined as an autoimmune disorder where the pancreas produces little to no insulin in the body. This is due to the destruction of 80 to 90% of the beta cells. Insulin is the single hormone which controls and manages the glucose levels and regulates metabolism of fatty cells, proteins, and carbohydrates by absorbing glucose from other body cells. For diabetics, however, they lack this hormone to regulate blood glucose levels. Insulin is defined as a peptide hormone which is produced by the islet of Langerhans beta cells in the pancreas. Its primary role is to transport and metabolize glucose by converting it into energy for the use of body cells. When beta cell mass declines, it adversely results in the decrease of insulin production in the body and fails to maintain normal blood glucose level. This also increases the blood glucose levels due to the unstimulating of fat in adipose tissues. Treatments should include means of supplying exogenous insulin in order to prevent catabolic reactions, control glucagon productions, which will also assist in stabilizing blood glucose levels, preventing ketosis, and maintaining a normal lipid and protein metabolism, ultimately achieving homeostasis. There is a strong relationship between glucagon and insulin. When hypoglycemia occurs, glucagon is released and signals the liver to release glucose into the bloodstream for regulation. However, due to the lack of insulin efficiency for diabetics, the presence of glucagon alternatively raises blood glucose levels because the body has now an impaired response to insulin. Consequently, the patient becomes hyperglycemic and the blood glucose levels are unable to be regulated. These metabolic disruptions will impact on patients with type 1 diabetes by rapidly increasing the diabetic ketoacidosis due to the absence of insulin. The destruction of beta cells impair the tissue's response of insulin, and as a result, these insulin deficiencies elevate the uncontrolled level of free fatty acid, lipolysis in plasma, and will suppress the level of glucose metabolism. Risk factors. Age. Type 1 diabetes can appear at any age, but are more likely and prevalent in younger adults and are far less common in 40+ age groups. This is the most common chronic disease which appears in 2 noticeable peaks. The first peak is visible in children between the ages of 4 to 7 years old, and the second peak between the ages of 10 to 14 years. Environmental causes. There are 2 types of environmental causes that are associated with increasing the risk of type 1 diabetes. The lack of good hygiene and poor living conditions can all increase the risk of developing allergies and autoimmune diseases within children. This can lead to a suppressed immune system, which makes one more susceptible to developing type 1 diabetes. Genetics play a large role in increasing the susceptibility to type 1 diabetes, which is completely out of one's control. Certain ethnicities are at a higher rate of experiencing type 1 diabetes in comparison to other ethnicities. For example, Caucasian Americans in America are more likely to develop type 1 diabetes than most other ethnic groups. Early diets in childhood play a major role in determining the exposure level of a range of autoimmune system diseases. For example, cows and formula milk are notable mentions. Other autoimmune conditions. Type 1 diabetes is known as an autoimmune disease whereby an immunoresponse is evoked to fight off foreign bacteria and viruses. Over 90% of diabetic patients, however, have autoimmune thyroid diseases as a comorbidity. Signs and symptoms. Patients with type 1 diabetes indicate these signs and symptoms during the diagnosis period. Polyuria. When hypoglycemia occurs, The body attempts to remove the excess glucose and fluids through the urine. Consequently, the kidneys filter out more water, leading to increased urinary output. Polydipsia. Patients with type 1 diabetes feel thirsty because they are hyperglycemic, which increases thirst. As a result, the kidneys start to produce more urine to remove extra glucose from the body. Thus, there is a major fluid loss which triggers the brain to drink more water in order to compensate. Polyphagia. In diabetes, due to the deficiency of insulin resistance or level, glucose cannot enter the body, which is unable to convert glucose from food, which leads to increased hunger and appetite. Ketoacidosis. Due to the lack of insulin, the body starts to break down fatty cells and other body tissues to compensate. This creates an acidic chemical known as ketones, which decreases the pH levels of our blood. And ultimately, this results in the occurrence of polyuria, fruity breath, excessive thirst, and fatigue. Damage in body. Due to the effects of hyperglycemia, it can negatively impact small blood vessels and nerves in the eyes, kidneys, and heart. It promotes arteriosclerosis, which over time can lead to heart attack and stroke. Blurred vision and impaired vision. Hypoglycemia pulls all the fluid from the lenses, which results in blurred vision. Weight loss. Once the body produces less insulin, it burns fat and muscle for energy demands, which causes weight loss. Diagnostic testing. Oral glucose tolerance test. This is a comprehensive test which assists the diagnosis of type 1 diabetes. It includes a fasting blood sample first to be collected, followed by a 75-gram bottle of glucose to be consumed within the 5 minutes thereafter. 1 hour and 2 hours post-drink, a blood sample is first collected. If when fasting BGL is greater than 7 millimoles per litre and post-drink is greater than 11 millimoles per litre, this is indicative of type 1 diabetes. The quickest option of all of them is the random blood glucose concentration. Using a testing kit, blood is first drawn using a lancelet and placed on the strip, whereby the meter then measures the current blood glucose level. If the results are 7 millimoles per litre or higher, it can be indicative of type 1 diabetes, because the universal normal range is 5.6 millimoles per litre. Urine analysis. They are used to detect the presence of glucose and ketones in the urine. Clinical management of the patient by the healthcare team in the hospital setting. Education comes first. A nurse should educate the patient on how to arrange their diets in order to better manage their conditions. Ideally, a patient's meals should consist of 45% to 60% carbs, less than 20% fats, and around 15 to 20% protein. Carbohydrates should only be complex carbs, as the blood glucose spike is not significantly rapid post-meal. Fats don't have a significant effect on BGL, but they are useful in slowing down carb absorption. Protein provides a steady energy boost with very little effect on BGL, and that gives us the full feeling, so we eat less and helps with sugar cravings. Patients should also be educated on exercises, as it helps with insulin sensitivity and thus decreasing insulin demand. Aerobic exercises such as jogging, swimming, cycling, and walking are ideal. Nurses ought to educate patients on self-monitoring their BGL before exercising, and if there are approximately less than 100 millimoles, then they should eat a small snack to avoid hypoglycemia. But if the patient's glucose level is too high, that means there are ketones present. They should then cease exercising, as they make more ketones and decrease the pH levels in their bloodstream. Patients should further prevent hypoglycemia risks by carrying simple carbs with them, such as fruit juices and hard candies, both of which are great examples. Tell patients to monitor their BGL and urine ketones every 4 hours, and when they're feeling unwell, it means that they are at high risk of getting DKA. Remind patient to keep drinking more water, preferably every hour, as dehydration exacerbates the illness and its symptoms. Monitoring and assessment. Monitor the patient's BGL regularly, and if it's greater than 15 millimoles per litre of blood, then check for ketone levels and notify the doctor if this is a regular occurrence. If any of the following signs and symptoms are present, the RN should then notify the doctor. The presence of ketone in the urine, which is identified through excessive thirst, excessive urination, abdominal pain, nausea, vomiting, and fruity breath. The nurse should be aware of the 3 Ps as it indicates DKA: polydipsia, polyuria, and polyphagia. Rapid weight loss and Kussmaul breathing, which is essentially deep rapid respirations, can further indicate DKA. Physical examination. Nurses should regularly assess skin integrity, such as skin turgor from dehydration or any slow wound healing as a result of poor circulation. Pressure area care. Frequent bathing and moisturization of skin can prevent skin breakdowns and is ideal for diabetic patients. Administering medications. Nurses must prime the insulin IV line with insulin first, because insulin naturally absorbs into the line, and thus the full dose of the insulin ordered can then be delivered into the patient's body. Insulin is given subcutaneously, and only IV insulin given is regular insulin. Rotate the sites of injection is important, as patients can develop lipodystrophy, which causes fat layers to be uneven and causes a display of dimples. Never massage or put heat pads post-injection, as this increases blood circulation and medication dispersion. As a result, the patient may overdose on the medication and become hypoglycemic. Mixing insulin should be from clear to cloudy. Important to be aware that patients may have the dawn phenomenon, where they appear hyperglycemic in the morning and the waking hours because the body thinks that you need the extra glucose in order to wake up. Diabetics, however, can't handle the glucose, so be sure to give them a nighttime dose of intermediate-acting insulin. Patients may also undergo the Somogyi effect, which occurs during 2 to 3 a.m. The body experiences a drop of BGL, so the body compensates with hormone releases such as cortisol, growth hormone, and catecholamines. In turn, the body is hyperglycemic for diabetic patients. To prevent the BGL initially spiking, having a bedtime snack can help or decrease the bedtime insulin dose. There are 4 insulin types: rapid acting, short acting, intermediate acting, and long acting. Nurses should be aware of the onset, duration, and peak times of each type, as misapplications can cause the patient to go into a hypoglycemic reaction or shock. Medication management. In type 1 diabetes, insulin is unable to be reproduced by the pancreas, and therefore exogenous insulin replacements will be able to regulate blood glucose levels and assist in storing excess glucose for energy use. Lifelong insulin replacements using insulin injections and insulin pumps. Insulin is injected through the subcutaneous tissue, and the reason for this is because insulin are absorbed rather quickly, as this, when done too quickly, can dangerously lower blood glucose level, consequently sending individuals into a hypoglycemic coma. This is important to note that insulin should be balanced with food, activity, lifestyle choices, and blood glucose levels. This can be achieved through effective nurse-to-patient communication and education. Lastly, complications. Hypoglycemia, also known as hypo, is when your blood glucose level has dropped too low. While it can be experienced by people taking certain medications for their symptoms, it is more commonplace in people who take insulin injections for type 1 diabetes. Hyperglycemia. It is often referred to as hyper, which means high blood glucose levels. It is entirely possible for one's blood glucose levels to be high and for the person to not be aware of it at the same time, since most do not actually experience the symptoms of hypoglycemia And this is where the clinical management skills should come into place. Kidney diseases. Kidneys help cleanse our blood, rid it of toxins, and pass them out as urine. Through a process called diabetic nephropathy, diabetes can damage the filter part of the kidney and thus causing a leaking effect which allows protein into the urine. Nerve damage. Chronic damage to the nervous system caused by diabetes is called diabetic neuropathy. It can result in a loss of sensation in one's limbs. Reduced circulation from high blood glucose can affect normal wound healing in your extremities. Amputation are sometimes considered by medical professionals in the most extreme of cases. Heart disease. Diabetic patients have a much higher risk of heart disease and even strokes, and this is due to the raised blood glucose levels along with the high blood pressure and cholesterol levels. Diabetic ketoacidosis, also known as DKA, and you might have heard this word being mentioned previously in the presentation. And this complication takes place when there is a severe lack of insulin present in the system, causing the body to break down other body tissues for energy in place of the usual glucose reserves. Ketones are toxic byproducts of DKA, and when ignored, will likely cause the body to become acidic and therefore should be treated with urgency as always. Diabetic retinopathy is also known as the eye disease. Diabetes can severely damage the back of one's eyes and impair one's vision. It can potentially result in blindness, both temporarily and permanently. Hearing problems. Researchers believe that due to the increased blood glucose levels, oxygen supplied to the blood vessels of the inner ears are greatly reduced, which causes long-term damage to the auditory senses. Other complications include autoimmune disease, namely the celiac disease, which greatly reduces the effectiveness of one's immune system. It could then lead to the development of other diseases as well. Oral health, gingivitis, periodontitis, dental caries, xerostomia, and oral thrush are the results of persistent high blood glucose levels. Persistent infections, prolonged and exposed as well as unhealed wounds can increase the risk of infection. Due to the compromised immune system, it may even become chronic.